Okay, we're going to go ahead and get started. Welcome to Improving Outcomes for Crossover Youth, Spreading Lessons Learned from Implementation of the Crossover Youth Practice Model. So this webinar is hosted by the California Evidence-Based Clearinghouse for Child Welfare, commonly referred to as the CEBC. So my name is Jared Martin. I'm with the CEBC and I'll be moderating today's webinar. Before I introduce our presenters, I'll be reviewing some webinar logistics and also some background information on the CEBC. So first, and this is very important, if you could please take a couple seconds to make sure that your phone lines are muted so that we do not hear any background information from background audio from the participants. So we would greatly appreciate that. If you are experiencing any technical difficulties or have any urgent questions, please use the Q&A pod located at the bottom of the screen, and we'll do our best to assist you. If you have any questions for the presenters, please submit them using the same Q&A pod. We'll save your questions for the Q&A session conducted at the very end of the speaker's presentation. Also, the PDF of the PowerPoint slides and other handouts are downloadable from the Adobe Connect platform in the bottom left corner of your screen. So please note that this webinar is being recorded and will be archived on the CEBC website for anyone to view within the next few days. And lastly, you'll receive an email with a link shortly after the conclusion of this webinar to complete a brief survey so that the CEBC can improve our webinars and make them as useful and relevant as possible. So for those of you who are not familiar with the California Evidence-Based Clearinghouse, the bulk of our work can be found on our publicly available website where we provide plain language summaries of research studies on practices that are relevant to or commonly used with children, youth, and parents involved in the child welfare system or at risk for involvement in the child welfare system. So the CEBC website currently features over 450 practices that we've reviewed and rated, and that's over 45 unique topic areas. So we're looking at areas like mental health treatments, parent training programs, domestic violence, anger management, and many other areas relevant to child welfare. So anyone can access and explore the information on our website, and if you haven't already, we encourage you to do so. And lastly, the CEBC is funded by the California Department of Social Services, Office of Child Abuse Prevention, and operated by the Chadwick Center for Children and Families at Rady Children's Hospital in San Diego. So in June of 2018, the CEBC added the Crossover Youth Practice Model to the case practice topic area of the CEBC website. So what you see on your screen now is a screenshot of the CEBC's description of the model. So if you want more information about the model beyond what the presenters discussed today on the webinar, feel free to access the URL on the bottom of the screen. I'm not going to be reviewing this in detail, but what I do want to call your attention to at the center of your screen is the scientific rating. So the Crossover Youth Practice Model is currently rated a 3 with promising research evidence. So what this means, put very simply, is that in order for a practice to be rated a 3, it requires at least one research study published in a peer-reviewed journal, and that study demonstrates pre-post improvement in outcomes compared to a control group. So a control group could be something like a practice, an alternative practice, or a wait list, or a group of participants who did not receive any services. So I'm not going to go into any more details about our scientific rating scale because that's not the focus of today's webinar. But if that is something that you would like to learn more about, again, please visit our website where we provide very clear, detailed descriptions of how we evaluate research, and we have also conducted webinars on this topic that are archived on our website. So before I introduce our presenters, we have a quick poll question for the audience. So you should see a pop-up box on your screen that allows you to respond to this question. And the question is, what service sector do you work in? So the first response is A, child welfare, B, juvenile probation, C, mental health, D, legal services, E, community-based provider, if you're a CASA or a housing provider or any other service provider. If you're in academia or research, or G if you're in another field that's not listed. So we'll give the audience a couple seconds to please indicate what service sector you work in. All right, so can we broadcast the results? Okay, so it looks like the majority of you are in child welfare, yeah, followed by mental health. Well, people are still responding, which is great. So this is giving us an idea of who's in the room, so we appreciate it. So yeah. All right, so this is helpful. Thank you. Go ahead and end the poll. All right, so now I'd like to introduce our presenters for today's webinar. First, I'd like to introduce Mrs. Macon Stewart. She is the Deputy Director for the Multi-Systems Operations for the Center for Juvenile Justice Reform at the Georgetown University's McCourt School of Public Policy. As one of the authors of the Crossover Youth Practice Model, Mrs. Stewart manages the implementation of the model in 100+ communities across the country. Mrs. Stewart also manages the center's work as part of the Center for Coordinated Assistance to States in partnership with American Institutes for Research and Council for Juvenile Corrections Administrators. Prior to joining CJJR, Mrs. Stewart worked for the District of Columbia's government's Child and Family Service Agency. During her tenure, she held various positions including social worker, case practice specialist, and project manager to the Deputy Director for the Office of Clinical Practice. Mrs. Stewart holds a Master's of Social Work degree from the University of Pittsburgh and a bachelor's degree in criminal justice from the University of North Carolina at Charlotte. Following Mrs. Stewart's presentation, we're going to have two separate implementation sites present on their work implementing this model. So first, we're going to hear from the San Diego, California jurisdiction, and that team includes Frank Barone from the Office of the Public Defender, Stacy Black from the Department of Probation, Jillian Rose from San Diego Health and Human Services, Crystal Sweet from Department of Probation, Krista Baxter from the County Council for Child Welfare Services, Stephen Wells, also from San Diego HHS, Steve Wydell from Children's Legal Services, and Lisa Weinreb from the Office of the District Attorney. Following San Diego, we'll hear from the state of Florida, specifically Marion County, and we'll be hearing from Joelle Abotiz from Florida Department of Children and Families, and also Randy Reynolds from Florida Department of Juvenile Justice. So with that, I would like to pass the presentation over to Mrs. Stewart.
Okay, thank you, Jared, for that introduction, and welcome everyone. So I'm going to go ahead and get us started. Today our learning objectives is to give you all a sense of the current research related to this population of young people and talk about the links between maltreatment and delinquency and what the implications for practices and reform are via the Crossover Youth Practice Model. We'll give you an overview of the model itself and some of the system outcomes as well as some of the data that we've collected through several of our implementation sites, as well as talk a little bit about some of the results that we've seen from some of the independent evaluations that have been done by two universities, and then we'll learn about the model itself and give you all, you'll be able to hear from two of our sites that have been implementing the model and understand about those practices that are happening there. So with that, I'm going to go ahead and jump right into the presentation. First of all, by laying out some definitions. And for most of you all in the field, there are a number of different terms that float around that reference this population of young people. So I'm going to talk about several of them here. And just also want to note to folks there's some more recent research that has been done that's coming out of Cal State Los Angeles that was done by Dr. Denise Hers and Dr. Carly Dirkheising that gives us updates on these definitions and further clarifies who these young people are. So in the broadest sense of the word, the term crossover youth is used, and what that term really lays out is a young person who has experienced maltreatment and who is also engaged in a level of criminal activity, but this young person may not be known to our systems. And so why it's on the outside is because that is the largest population of young people who have experienced maltreatment to some degree, have engaged in criminal activity. They may or may not be known to us in any capacity. Next, what we have are young people who are considered dual system youth or dually involved youth. These are young people that are touching both the child welfare and juvenile justice systems to some degree. There's not formal involvement in both. There may be formal involvement in one, but they are touching each. So, for example, this could be a young person that is currently receiving, quote-unquote, voluntary services from the Child Welfare Agency. They then are arrested and charged with some level of a misdemeanor, and now they're going through the charging phase and pre-adjudication phase in the juvenile justice system. So they're touching each of those systems, although they're not formally involved. So again, the terms used to categorize those young people would be dual system youth or dually involved youth. And then this last bucket are young people who are dually adjudicated. These are young people that are touching both the child welfare and the juvenile justice system, and they've been formally adjudicated in both. And the work that we do around the crossover youth practice model in communities really looks at this segment in the middle, these young people who are considered to be dual system youth or dually involved youth, because we know that they exist and because they are in fact touching both of the systems to some degree. That gives us the impetus for starting to work together and do something. So next I'm going to talk just a little bit about the pathways that young people travel going between these two systems. Pathway 1 is a young person who has an open child welfare case that then commits a subsequent delinquent act. So whether it's referral or arrest, the delinquency happens after the child welfare case has been opened. And for us, the reason why this is labeled Pathway 1 is because from the national research, it is the most dominant pathway that young people travel who are crossing over between these two systems. Again, the national research has told us that, as well as research that we have done on the communities that we have worked with, it continues to be the most dominant path for most sites across the country. Needless to say, there are some exceptions where other pathways may be more prevalent, but overall, Pathway 1 is the most dominant. Pathway 2 is a young person who has a history of involvement in child welfare, but there's not a current case, but then they have a referral to the Department of Delinquency. And so generally what we see, and I'll talk a little bit about it later in the slide, is that a lot of young people who are currently involved in the juvenile justice system have had some experience in child welfare while their case may not be current. So we do see a fair amount of that. The latter pathways, Pathway 3 and 4, start generally with the juvenile justice system. So Pathway 3 is a young person who is under investigation with the delinquency system, and then there's a suspicion about maltreatment, and so a referral is then made to the Child Welfare Agency. And Pathway 4 is a young person who has been placed in a deep-end juvenile justice correctional facility, and then as they're preparing for discharge and transition, the family has not been engaged, and therefore this young person does not have a home to return to, and by virtue of that, this young person is then referred to the Child Welfare Agency for some level of placement and intervention to support them. So next we have a poll question. I think, Jared, you're going to do our poll for us.
Yes, so let's go ahead and advance the slide. So once again, audience members should see a pop-up box up on their screen that allows them to respond. So the question is there a body of work occurring in your jurisdiction that focuses on youth that cross over between child welfare and juvenile justice? So we'll give a couple seconds for the audience to respond. Broadcast the results. So looks like the overwhelming majority of you indicate yes. So great.
Right.
We'll go ahead and end the poll.
Okay, thank you. And that's really promising to see that we do have a fair number of folks who are participating in this that do have something going on in their community, be it via the practice model, just local initiatives that are addressing this population, or if you're working with other organizations in that regard. So what we're going to do next is just talk a little bit about who these young people are, what are some of the demographics, and what are some of the characteristics of these young people. So in terms of demographics, what we know is that there's an increased likelihood of these young persons being female in comparison to male. And what that means is when we look at the population of young people involved in child welfare, the proportion of them when it comes to gender versus male over female, and then looking at the delinquency population as well, the split between gender male versus female, what we see is that a young person who crosses over has an increased likelihood of being female as opposed to male. There are several hypotheses around why that is. Some of those include there's a speculation that a lot of times when young women who are involved in the child welfare system are engaging in risky behaviors that are putting them at risk for things such as human trafficking, et cetera, that there is that judicial officers or folks are generally likely to have them detained or put in a more restrictive setting to kind of protect them from themselves. Of course, that I know of, there's not any research to support that, but that has been some of the things that we've heard around the field. Also is that these young people are more likely to be African American or young people of color when compared to their white counterparts. Also, these young people are generally younger at the age of their first arrest than a young person that is not involved in the child welfare system. And what that really allows us to start thinking about is what are some of those experiences that young people who are involved in the child welfare system may be having that are putting them at risk for becoming involved with the delinquency system. So something for communities to think about and take a look at. Some of the experiences that these young people have as it relates to abuse or neglect and or their involvement with the child welfare system is that as it relates to why they came in, is that a lot of these young people have either persistent maltreatment, so persistent in that the maltreatment has occurred for long periods of time, or they have generally experienced adolescent-specific maltreatment alone. So what we see is that generally these are either teenagers who are newly known to the child welfare system, or they're young people who have been involved in the child welfare system for very, very long periods of time and permanency has not been achieved, and so they're more likely to cross over. When we think about types of maltreatment, generally these are young people who have been victims of abuse. These are young people who have typically had a high number of placements in the child welfare system, and particularly have been placed in some of our in congregate care facilities, group homes, or residential settings. And also these are young people who typically have an absence of positive attachment. So, if you think about young people who have been in child welfare for a long period of time, generally they have had a lot of placement moves. And when you have a lot of placement moves, you're changing schools, you're changing your residential setting, you're changing your neighborhood. And so that really hinders your ability to develop those relationships and attachments to individuals. And that's where these young people generally are left at. And so those are some of the things that we see in these young people. Additionally, some other characteristics that we see is that in terms of education, these young people are not faring well. A lot of them have issues related to truancy, have dropped out, or are being pushed out. A lot of them have special education issues that may or may not have been identified. And, of course, if you're not going to school, then you're not receiving that level of services that is warranted related to your education. A lot of these young people come from families that have a significant history of mental health, substance abuse, domestic violence, or having engaged in other levels of criminal activity and behavior. So again, these are young people in our child welfare system who generally have a higher level of need given all of these factors. As it relates to juvenile justice involvement, what we see is that less than half of these young people have been charged with a violent offense. About 1/4 to 1/2 generally have been detained at the time of placement, and a lot of them have had prior contact with the delinquency system in some capacity, generally with a lower level offense or some sort of a status offense, but there has been some level of contact. So just want to talk a little bit more about education and specifically some of the challenges that we see. So one, I just want to highlight what we're seeing as it relates to just a young person involved with child welfare or juvenile justice individually and not both systems. So young people who are in child welfare have higher risk for lower grade point averages, having missed a lot of school, having repeated grades, or experiencing a lot of behavioral problems. Young people involved in juvenile justice have some of the same things. They also have reduced educational attainment when compared to their non-delinquent peers. They may have been incarcerated and exhibit both substantially lower high school completion rates and are more likely to be involved in adult corrections. And so what we see is that for crossover youth, they likely experience the compounding effect of having all of these, and then coupled with all of the additional mental behavioral health issues, and then the absence of those attachments, it really impacts not only their school performance, but also where they then transition to as they start moving on that path to adulthood. So again, all the things that we highlighted really just intensifies the need for us to have some focused attention on this population of young people. This next slide just talks a little bit about the experiences that young people who are involved in child welfare have when they then cross over into the delinquency system. At the pre-adjudication stage, what we see is that generally these young people are not identified timely. Most communities that we work in do not have a mechanism. When we start working with them, I'll say do not initially have a mechanism by which they can identify who these young people are or know that a young person who's sitting at the door of detention or going through a juvenile justice intake process has involvement with child welfare and there's another system we should be engaging. That's not happening in most places. And these young people are more likely to be detained when in comparison to their other peers. As it relates to charging, there's a perception that these young people, dually involved youth, have a higher risk or at a higher risk, and so they are less likely to receive diversion when compared to young people who may be getting charged with some of the same types of crimes. As it relates to disposition, what we see is that these young people are less likely to receive probation supervision, where they're going to be placed in the community, back at home, have services within the community setting, and they're more likely to be placed in a more restrictive setting, such as a group home or some deeper in locked corrections facility. And again, what we also see is that these young people, when you think about the juvenile justice trajectory, the deeper in that that a young person goes in the system, the higher the percentage of the young people who are involved in child welfare. So, and I'm not sure if I have a slide that depicts that, but that is one of the things that we see. Oh, yep, here it is actually. Okay, so next I'm just going to talk a little bit about some of the characteristics related to their involvement in JJ again. And what we see is that crossover youth are more likely to be detained at the pre-adjudication stage, and there are a couple of again, hypotheses that suggest why. One is that there's the lack of communication between juvenile justice and child welfare means that the juvenile justice system does not know where to release this youth to and whom to release them to. And so because of that, young people are sitting and waiting while the other agency knows, they're able to find them a placement, et cetera. But it's just that issue of not knowing the who and who to call oftentimes mean that they're languishing in detention. Also is that once we do know, a lot of times placement providers are not willing to take this young person back, and so the young person therefore is remaining in detention while attempts are being made to identify a placement resource for them to return to. And so the thing that we try to push communities to think about is how does that impact a young person sitting in detention? And having worked in child welfare, I know the challenges with finding placements and finding adequate placements, but we also know that detentions are not suited for young people to be staying in for extended periods of time, regardless of the reason. So we try to work with communities in understanding that, identifying resources so that young people are not detained longer than necessary. So the next slide gets into a little bit of what I was talking about earlier as it relates to where these young people end up in terms of their disposition in juvenile justice. What this slide shows is that the deeper in the juvenile justice system that one goes, we see the higher percentage of young people who are involved with child welfare are more likely to be placed there. So DCFS is the child welfare agency in in California. This is done in a California county. And what we see is when we look at probation, we have a higher number of young people who are not involved in child welfare who are placed on community probation. But when we look at suitable placement, which is probably like a group care facility versus a correctional placement, we see that we have a fairly large percentage of the young people who are involved in child welfare that are placed in those more restrictive settings. So next we just want to talk a little bit about mental health and substance abuse issues that we see in these young people. Again, this data was taken from an evaluation of the 241.1 MDT program in Los Angeles, and what we see is that while a fair percentage of these young people have either mental health or substance abuse, a very high percentage of them have both. And so we need to be sure that we're drawing our attention to not just how the systems work together to better serve them, but think about the services that are being put in place for them to really begin to impact those issues that have been identified. So really what we see is that these young people have higher rates of substance abuse and mental health issues, have higher rates of recidivism, higher rates of involvement in in criminal activity as adults, and also these young people also have higher rates of child welfare involvement as parents when we think about the long-term trajectory. So all of these really speak to the fact that we need to be doing something. So next we have another poll question that we're going to put out there for our listening audience. So Jared, I'll turn it back over to you.
Great. So this is our final poll question. So you should see another pop-up on your screen come up shortly. And the question is, what are some systemic barriers that impact youth that cross over in your jurisdiction? So A is placement stability, B is lack of positive attachments, C, lack of quality behavioral health services, or D, all of the above. We'll take a few seconds to allow audience members to respond. And I'm going to go ahead and end the poll now. So it looks like most folks, it was the majority were all of the above.
Mm-hmm. All right. Thank you. Thank you for that. And again, I appreciate you all's response to that, and I think the responses just bring to bear the need for us to not just be looking at one particular thing as it relates to how we improve servicing these young people, but thinking about just the overall quality of care that these young people receive in our systems. And, you know, I know that we tend to go towards only thinking about placement, and placement is extremely important because, you know, young people absolutely need a safe and stable place to be, but there are so many other things that impact their ability to remain safe in a placement and have a placement that is going to be able to kind of survive the long haul for them. So just some things to think about as we move forward in the presentation and your learning today. So next I'm going to move into talking about the crossover youth practice model itself. So the model has been around. We started developing it 2008, 2009. We launched it in partnership with KC Family Programs in 2010. We originally started out with just 13 communities that first year in 2010, and now we're in over 100 counties across the country that have been exposed to the model and implemented the model. So it's grown very rapidly, and what we see is that there's a continued need for addressing this population of young people. The thing that I always say is we can make a decision to do nothing. That's well within our right. However, the young people are going to continue to experience these things, and in us wanting the best for them, it's really incumbent upon us to do something. What we also know is that the amount of funding that our systems have to provide services, et cetera, for all of our young people is dwindling. And so if we have a manner in which we can work across the aisle, or remove our silos from each other and start to share in resources, share in staffing, share in services, et cetera, it maximizes our ability to have impact. What we see in a lot of communities is that services are being duplicated, assessments are being repeated, information is not being shared, and so really what we're doing is we're not being good users of the resources that we do have. So the model supports bringing people together and really maximizing that. So what I'm going to do is just talk a little bit about the model itself. As you can see, here's a list of all of the jurisdictions that we're in. Right now we're in 21 states. I think our current count is we're at about 110 sites across the country. And again, what the model looks like everywhere, it varies a little bit, but there are 25 tenets to the model I'll speak a little bit about. But every jurisdiction is different, and how they process and manage cases varies. So therefore, those are some of the differences that you'll see in the model in the various sites that we're in. And if anyone who is on the line has questions about what may or may not be happening in their community, our contact information will be listed at the end of the presentation. You can reach out to me, and I'll be able to point you in the direction of who's doing what and where. So next, I'm just going to give a little overview of what a practice model is. What it is really is just a conceptual map or ideology that really gives definition and explanations to how your staff will come together and partner, how you engage stakeholders and improve the delivery of services that you provide to the young people and families that you're working with. The practice model has a set of values, and just for the sake of time, I won't go into detail about these, but really what we aim to do is focus on how we use data and get away from using antidotes to drive our decision making. We also assert the power and strength that families have, and want to ensure that we are respecting that and we're seeing them as individuals and not as just a group, but we're looking at what their individual needs are as we service them. Also really looking at workforce efficacy and ensuring that we are strengthening our frontline staff, our judges, our attorneys, et cetera, to really think about how they support young people and really enhancing their knowledge. There are a couple of themes that we have running through the practice model. They are related to family engagement. We should be engaging families at every point through the life of the case, regardless of what one's opinion is about a family, figuring out the how to, not the why not. Thinking about gender and understanding that there are differences relative to gender and how we provide young people services, and also permanency. That permanency should be something that everyone focuses on in this work and not just based on one system's thoughts or ideas about it. Also coordinated case management, ensuring that we're working smarter, not harder, and that we're working together to coordinate our efforts, that we're sharing and funding and resources that we do have, and also that we're sharing information, which is one of the biggest barriers that we work with communities on, is figuring out how do we do that. Next, I'm going to talk about some of the areas that we like to see reductions in the model, is that we want to see a reduction in the number of youth that are placed in out-of-home care, the number of youth that are crossing over and becoming dually involved, our use of congregate care, as well as a disproportionate representation of young people of color, specifically in the crossover population. And the reductions in these areas just really speak to some of the things that were discussed earlier around the national data and what we see and how young people move between the systems. Other areas that we want to see reductions in are the number of young people that are re-entering child welfare from juvenile justice, reduction in education instability, rate of recidivism, the level of penetration in the juvenile justice system by our young people in foster care, the use of APLA as a permanency goal, and the use of pre-adjudication detention. So some of our process and practice goals, things that we want to see go up, are inclusion of family voice, parents and young people's satisfaction with us as a system and the processes we've put together, positive youth development and our engagement of young people in pro-social activities and opportunities, increases around joint case assessment and planning, information sharing, and our use of diversion in the juvenile justice system for this population of young people. So next I'm going to just quickly talk about the crossover youth practice model and the different phases. Phase one deals with our ability to identify who these young people are and impacting their stays in detention. So number one, we work with communities to set up a process for how we're going to identify who they are. If we don't know who they are, then we can't impact anything else. So ensuring that there is a process for identifying them. We also look at those things that communities are doing that may be pushing a young person from one system to the other, so there is a prevention element too that goes into the work. Again, we look at how detention decisions are made. How do we support youth who are placed in detention and ensuring that they're not there for extended stays, and also making a collaborative decision around how we're going to move forward with charges and ensuring that everyone understands what the charges are, and how young people will be, how their court case will proceed if such should happen. In phase one, we also look at how we make those notifications, during the juvenile justice intake process, ensuring that the young person is present. Child welfare is a part of that juvenile justice process. So if they are diverted, if they're put on an informal charging process, or if their charges are moving forward, that child welfare and all other parties to the case are knowledgeable about those decisions. The next part of the practice model gets into phase two, which is joint assessment and planning, so ensuring that there's collaboration around that assessment and planning as we move forward, and we're engaging in collaborative case management and oversight for the case. Phase three gets into how we manage the case in an ongoing manner if the young person does, in fact, become duly adjudicated, and then how we also work together around planning for permanency, transition, and case closure, again, ensuring that it's not just the responsibility of one, but it's something that we're thinking about and working toward during the life of the case. So really quickly, I'm going to talk about some of the data outcomes that we've seen in the model. This slide just gives you an overview of how we do our study in the crossover youth practice model. We take a sample of young people who would have not been recipients of the model, and then we also take a sample that we call the treatment group of young people who received the model, and we do pre- and post comparisons at the 9-month marker after implementation starts. So we're able to really get a real clear picture of how the model has impacted young people. So the findings that I'm going to present to you now come from 19 jurisdictions. A sum of about a little over 1,800 young people were a part of this. And these are the 19 communities that were involved in the data that will be presented. And so what we've seen is that these bubbles represent the communities and the changes that we saw in practice. The first one represents showing an increase in the number of young people that received diversion or dismissal. The next one shows a decrease. These sites saw a decrease in the use of pre-adjudication detention. These communities saw increases in young people's contact, whether it be with family, with their parents, other family members, or non-family members who were of importance to that young person. This slide highlights communities that saw an increase related to young people's involvement in pro-social activities at follow-up, and so that was at the 9-month marker after their case was originally identified. The next slide speaks to improvements around educational outcomes. The first one has to do with increases around school attendance, improved academic behavior, and reduced behavioral problems within the school setting. Okay. Next, we're looking at communities that saw improvements in mental health as well as substance use for young people. And I apologize, I'm moving quickly through these because I know that we're running low on time, or my presentation time. The next slide really talks about permanency and young people who saw improvements in permanency goals at follow-up. And so what we look to do is to have young people who don't have the goal of APLA, but we're working more intentionally around connecting them to family members or relatives, or having prospects for adoption. And so this is status of the cases at the end of the follow-up period, that these communities had their cases more likely to have both the child welfare and the JJ case closed, and these two communities saw a change in that the child welfare was open, but the JJ case had been closed at the point of follow-up. Okay. These communities saw changes in recidivism. These communities saw fewer arrests. These other communities saw fewer sustained petitions for their young people. And this slide just gives you a summary of key findings. But what we've seen is that the CYPM has seen a lot of promise in areas around social supports, using young people having their cases dismissed or either being placed on diversion, reductions around use of pre-adjudication detention, increases around pro-social activities, and improvements around areas related to behavioral health. And so I won't spend a lot of time because I know we're winding down on time, but we've had two external evaluations that have been done. One was done by the University of Minnesota, and here's some of that data here, but it really showed successes around enhanced service delivery, information sharing, and a lot of improved opportunities for professional support for caseworkers who were servicing these young people. And so here's another slide relative to the study that was done by the University of Minnesota. The next slide shows data from a study that was done by the University of Nebraska at Omaha that assessed the impact of the model in Douglas County, Nebraska, on some of the improvements that they saw. And one of the unique things that they did as well is that they did a cost savings benefit analysis, and they found that the CYPM had realized cost savings even in the first year of $170,000 for that community. So not only are we seeing those improved outcomes, but we're also seeing savings for communities. And so here you can see your ability to contact us at the center with any questions that you may have, and also all of our social media handles as well. So with that, Jared, I will turn it back over to you.
Great. Thank you so much, Macon. Appreciate the wonderful information. So once again, to the audience members, if you have any questions for Macon, please submit them through the Q&A pod, and we will have a Q&A session at the very end. So now I'd like to transition to our first presentation from one of the implementation sites. So now we're going to hear from the County of San Diego. So I'm going to hand it over to Jillian Rose and Stacy Black.
Thank you. So while I wish that we had more than 20 minutes to explain San Diego's work with CYPM, it's important to know that we appreciate this opportunity to share our program. And we're a very tight team, which is why there's a whole lot of us in the room here. So let's get moving to the first slide. There we go. Okay. So the County of San Diego CYPM, why did San Diego implement CYPM? To ensure foster youth in San Diego County are treated equitably as any youth in the county who violates the law, provide accountability and a mechanism for change for youth to understand consequences and address behaviors with support of child welfare services. Youth who experience consequences of probation early are able to deter patterns of delinquency before they cross over straight to probation. It's also to provide a short-term intensive intervention to support the youth to successfully complete probation. Our goal is to have the youth 6 months. Our goal is to be seeing change within 6 months. So the players and the roles here in San Diego for Child Welfare Services is myself and my manager, Stephen Wells. For probation is Supervisor Stacy Black and Crystal Sweet. The District Attorney's Office, Lisa Weinreb. The Public Defender's Office, Frank Barone. Children's Legal Services, Steve Weddle. And County Counsel, Krista Baxter. We're a tight team, and we all communicate regularly on emails about any of the youth that come in. And if anyone had anything that they wanted to add, or I can move on. Okay, so the process here in San Diego County.
So the process is when a youth is arrested, it's either a youth who's been, a referral has been provided in custody or out of custody. A detention hearing then takes place where the court will set up a meet and confer. During the meet and confer, the probation officer and the social worker are discussing the case, assessing the appropriateness for which jurisdiction can better serve the youth. And if both jurisdictions would be successful in serving the youth, they would be deemed appropriate and recommended for dual status. At the dispositional hearing, the youth is ordered dual and is transferred to the dual unit for supervision. And in our county, we have units set up in probation and with social services that mirror each other so that we can keep consistency with our role in mentoring and parenting the youth. The dual unit assignment, they have their meeting with the probation officer and the social worker, preferably together, to discuss the roles and what services are provided and the case plan that we'll be working towards with the youth and their support systems. And then in our county, the extended foster care is provided either through probation or through CWS, depending on which is deemed more appropriate as the youth transitions into extended foster care.
And I just want to add, Stacy, on that one, that also when they're going through the meet and confer process, that they're also looking at diversion as well as informal probation for the youth.
Thank you.
So who are the County of San Diego dual youth? They're youth who have been unsuccessful in the lowest level of care. For example, home-based care, licensed group homes. Youth who have multiple foster placements, youth with significant history of child welfare and or law enforcement. Most of our dual youth are dependents with child welfare services who have committed a crime. So our working partnerships and strengths. San Diego County has a monthly CYPM meeting. It's a work group, and all of us it's there so that we can engage in our discussions about the practices and continuous quality improvement. The work group is often able to come to agreements on how parts of CYPM should work and address worries of the work group members. Probation and child welfare workers have a mirroring specialty unit, which Stacy just spoke about, but they visit the youth together to ensure the consistency of the expectations of both providers and agencies. They share case management responsibilities, and we meet quarterly as teams. Staff know one another well, and they have a very collaborative working relationship. The staff that are in these two dual units travel together to other states to visit the youth and know each other, and at times rely upon each other to help one another out with cases. Residential and probation both have special placement staff assigned to assist with the dual placement. This is super important so that we have our very own person to turn to whenever one of our youth is needing a new placement. We have a low number of youth assigned to ensure the best case management. And then let's talk about, okay, with every great program, there's got to be a couple challenges. So our challenges that we've gone through is the increasing understanding of how CWS and probation systems function together and interact. It's been extremely helpful to have our two specialty units so that each division can explain to the other division how things as simple as a clothing allowance could work. And
I'd also like to point out that each agency can share with the other agency what their own barriers are that they come across in working with the youth, and then if the other agency is able to have less barriers in doing so, then we kind of figure out how we can mirror that, or each agency takes lead in assisting the youth where the other agency may have barriers in doing so. So where one lacks, the other one can step up.
So we have there's varied perspectives about recommendations among parties. There's such a large group of us, we all have an interest for the youth, and we don't always agree. Biggest challenge, placement. Finding the most appropriate placement in state and in our county has been extremely difficult for us. A lot of our youth are out of state. We are looking for placements that are going to provide treatment for the youth that's appropriate for the youth, not just a placement to put them in. as well as youth remaining in those placements to be able to access the services that's being provided to them. We do have also transitioning our youth once they've completed their programs in another state, transitioning them back to California has been a challenge.
So the outcomes for our county for the last approximate 2 years, we've had a number of meet and confers. A lot of those have been diverted for services to remain within CWS. And of the 218 referred, 98 of those were deemed to be appropriate for dual status. Currently, we are above our range that we like to be. We're at 45, and we have had youth successfully complete the program, which almost doubles the youth that unsuccessfully terminated. We've only had 6 youth cross over into straight delinquency, which is a great accomplishment. And 18 were terminated without comment, which means that they couldn't necessarily be deemed successful, but there was nothing necessarily deeming them unsuccessful either. And then we keep track, statistic-wise, of the youth that become parents, have graduated or received their GED. They have gained employment, how many times they've AWOL'd from placements, and that's not just short-term AWOLs, but AWOLs that led to them needing a new placement, as well as how many placement changes they have. And how many of those end up receiving extended foster care services, and those that have engaged in additional criminal behavior, which that number is pretty low as well. So it seems as though our outcomes are indicating some success in San Diego. And I think that's because of the teamwork and the collaboration with our court partners and between the agencies, and specifically the collaborative partners in the community at the programs with the social worker and the probation officer acting almost as parents to the youth and guiding them through the system and ensuring that they're given all the services that are necessary for them to become successful.
I agree with that, Stacy, completely. It's also important that that Stacy and I are very close, and we don't always get along, but she and I don't always agree on outcomes.
We get along.
We get along. We're actually friends. But sometimes it makes it a little easier when it comes down to a case that we may not see the same outcome for the youth. So it makes it a lot easier to have that tight-knit family group. I'm actually going to put out the last few minutes for the rest of the group to speak if they would like to add anything that we might have missed.
I just wanted to add something.
Can you introduce yourself?
Sure. I'm Krista with County Council, representing Child Welfare Services on the dual status calendar. And one of the things that has been incredibly helpful to us is, as part of the implementation of our CYPM protocol, we have come up with a system whereby we are notified, multiple groups are notified when probation picks up a dependent youth. If that youth is detained in juvenile hall, there is an email blast that goes out to the social worker, to their supervisor, with the dual status players on it, asking very specific questions, and a questionnaire that goes out for a social worker or supervisor to immediately respond to, as to whether or not it's a declared, the minor is a declared dependent, whether the placement history of the minor, what the level of care was prior to being detained, and various information. And that alerts everyone right away that there is someone who is child welfare involved that has been placed in custody in juvenile hall even prior to the delinquency detention hearing. And I think that that has been a crucial step in trying to identify who is in the hall, who is child welfare involved, and expedited attempts to then have those minors spend less time in juvenile hall.
Steve Weedle from Children's Legal Services. We're an organization of attorneys and investigators, social workers who represent all the foster youth in San Diego County. Piggybacking off of what Krista said, we get notice one of our clients are arrested and other delinquency detention hearing. And since that's begun, we've started a process. We make sure an attorney, that client's attorney, is there in court at the delinquency detention. At first, we had a little pushback from the bench. They didn't understand why we were there. But now they look to us regularly to get more information and more background on the youth. They often don't have that. Usually they just have a delinquency detention report. They know nothing about the AWOL history. They know nothing about whether or not placements are available for that youth. And so it's been very beneficial both for the bench and our clients. So that's one real benefit coming from that notice.
And I'll piggyback on that. This is Frank Barone from the Public Defender's Office. We represent the youth on the delinquency side. Having the ability to communicate with dependency counsel, especially at a detention hearing, is hugely important to us. And so we've always been in favor of having them present. But also, as the dual status attorneys, we have a team of 3 attorneys who specifically handle this calendar. They're trained on dependency issues, and having that specialized knowledge, along with the assistance of the dependency attorney, the social worker, the probation officer. We have a good relationship with the district attorney and with county counsel. It's pretty much the norm that we have a conversation about every kid before we go out on the record in court. So we know where everybody stands and what the progress is and where it should be headed.
And I believe that the legal parties do a great job of keeping in mind the goal for the youth. And although they have their department to represent and the things that they need to accomplish in representing the youth, they also consider what is the best opportunity for the youth and often mentor the youth in going through the process. As well as, we mentioned that probation and social services have mirroring units. It's important to note that the youth, once designated dual status, remains with that same social worker and probation officer throughout their time in the dual status, and that provides the consistency and the relationship to help grow that youth and the trust that oftentimes they're lacking to ensure that there's going to be someone there consistently for them in addition to their attorneys and representatives.
I think too, this is Krista again, one of the important factors is in communicating with the public defender, district attorney, and children's counsel before we go on the record. We resolve as many issues as we can outside of the courtroom and oftentimes outside the presence of the minor. The minor has their attorneys with whom they can speak, and that can, I think, cut down on, we try to minimize any adversarial comments in the courtroom that could further aggravate or amp up the youth. We understand the population that we're dealing with and try to engage in a trauma-informed approach while we are in court. Certainly things need to be litigated. Everyone is entitled to zealous representation, but we make an attempt to narrow issues, work things out, and present things in a way that are less likely to inflame or aggravate or set up a youth who is there for the court proceeding.
I think just to add, this is Jillian, just to add that also Stacy and I are present in court for all the hearings every Wednesday. We have lunch together and then we sit in court together. And I think that's helpful because we know 100% what's going on with each of the youth. And I think that also cuts down on some of the challenges because we're there to answer questions. So if something needs to be answered right away, if that's, whether it be glasses or orthodontia care or clothing allowance or any questions that the youth have, especially if the social worker can't be there, we are there, both of us.
Okay, great. So thank you, San Diego, for the wonderful presentation. Again, to the audience members, if you have any questions for them, please use the Q&A pod to submit those, and we'll have a Q&A session at the very end. But I want to make sure we have enough time for our last group of presenters. So with that, I'm going to go ahead and hand it over to the folks in Marion County, Florida.
All right, good. Well, I guess we got a minute to go, so I guess it's good morning to California and good afternoon to everyone else, I believe. So my name's Randy Reynolds. I'm the Chief Probation Officer here in Circuit 5 of Florida. We certainly appreciate the opportunity to be able to present, so thank you for asking us. We enjoy talking about our protocol and the great things we're doing here in Circuit 5, Florida. But what this has done, I mean, this has done many things for us, but it's normalized a procedure for us on how we work with this population of youth. It's certainly helped us get a better understanding of how each agency works, and we'll talk a little bit about more of that as we go. And we certainly think we're getting and believe that we're getting better services for kids here. So them are some of the things that it's done for us. So as far as the learning objectives, I mean, we've already heard some of what Georgetown discussed. Now just to discuss a little bit of our process, but it's to gain a better understanding of our CYPM process, our best practices, and to do some practice examples at the end. So CYPM is certainly a priority here in Florida. So whenever I'm going to be referring to as Florida, but it looks different in every circuit. So it's been a priority for Department of Juvenile Justice, which is probation, as well as DCF, Department of Children and Families here in Florida. But it looks a little bit different in every circuit. It's been made a priority. So I'm just going to discuss what we do here in Circuit 5. Obviously the goal is to improve outcomes for youth who are dually served. We went live back in November of 16, and we've been doing this protocol, which we'll get into here in just a minute, ever since. I think we probably worked with Macon and Georgetown University for the better part of 2 years prior to that, and we finally just had to kind of be pushed out of the nest on it because we kind of delayed a little bit. But once we got going, I believe we hit the ground running. But when we started off, we broke up into several different work groups. We had a prevention and diversion work group, information sharing, MOU and local review team, which is our process of staffing, our DMC and RED work group, a data, inventory, protocol, and training work group. And then whenever we'd come back together, we'd report out on the meetings and conversations that we had. So, the next slide, Julie.
And the reason why this project was so important to us is because we have many agencies, state agencies that serve children in Florida, and we all tended to operate in our silos. As Macon mentioned earlier, there was duplication in services, duplication in efforts that were going on with the families, some confusion for families. And so this was our opportunity to kind of break down those silos and work together. And within Florida, we have a privatized system of care for foster care children, and so, you know, it increased the number of agencies that are involved. We have lead community-based care agencies that subcontract with case management agencies, that we also have privatized our mental health and substance abuse office as well, and so we've increased the number of folks serving one particular child. So the concept of the teaming approach became even more so important, which this model carries.
So we've, just as Macon had discussed earlier, we saw a lot of the same issues as other sites have. I mean, with many of these youth, you know, being out-of-home placements, decreased educational success, significant trauma. Many of the ones that are over 18 are homeless and unemployed, and obviously the majority of them have mental health concerns. And I think this is probably a good place to talk about. So those were kind of the barriers as far as working with this population, but we certainly had some barriers whenever we started the whole process. But the communication up front was the main key. I mean, the things that we had to look at from, you know, not just a probation standpoint, but a dependency standpoint was the workload, We're not going to get any additional positions or funding for this, so we had to develop the right message to our staff and train them on it. So we trained them a lot on it, on our process, and the message was the staff was to trust us, and there's going to be a little bit of work up front, but really we're just going to be moving a little bit quicker, and we're going to get answers quicker, and we're going to, hopefully this will slow down the process of these dually involved youth moving so quick through our system, and there won't be as many involved with us, which would be a good thing. And it seemed to work out pretty well, because one thing that we certainly know from this whole process is that this population of kids are certainly getting more services. There's absolutely no doubt about that. The concepts are, collaborate at levels involved with multiple agencies. We've included substance abuse and mental health providers. We coordinate our case plans, use evidence-based treatments, and, use trauma-informed practices. And one place I'd like to, talk about as far as probation, we've had assignments that we've turned into headquarters on gaps and things that we need, and it's been very appreciative that, headquarters has listened, and they've given us a lot of the services we need. We've got a redirections contract that is a cognitive behavioral therapy contract. We have a lot of slots here in Circuit 5. We've also just recently started a couple other contracts, and we've had this contract for quite a long time. We've also had a couple new contracts that doesn't have a slot limit on them, of kids that overflow that need to be gotten another services, because what we're seeing is many of these kids are sitting on a wait list for 2 months, 3 months, and by these contracts we're allowed to get those kids in services a lot quicker, which is what they need, because we don't need to be letting them sit idle without any services wrapped around them. So it's been certainly a pleasure getting these services from headquarters. So certainly wanted to make everyone aware of that. Something else that we were doing is that, whenever this whole process starts, it starts at the screening unit, and I'll talk about a little bit more about that in just a second, but the key is everybody that's involved in the email chain at the beginning, or the email group. I mean, we got, myself and my assistant chief and my reform specialists and supervisors and seniors here in Marion County probation, as well as with DCF. We got Joelle, we got their administration, we got their supervisors, all in the process of this, as well as KCI, which is our CBC, our community-based care provider here, where a lot of the dependency work is contracted out to. So there's administration from all three agencies are in the middle of everything, so we're seeing what's going on, and we're replying all, so everybody sees the step-by-step process. Obviously the goals of this is we're wanting to reduce the number of youth served with DCF and DJJ. We're wanting to reduce duplication of services as well as recidivism, increase the family engagement and collaboration, as well as cross-training. So kind of the highlights since going live with our CYPM protocol is that, we've established our protocol. It is pretty lengthy. We've got a lot of things in there, but there's a lot of good stuff in there. We've created this interagency LRT process, which is our local review team staffings, our inventory and navigational tools. We cross-train amongst agencies. We're certainly looking at this as a whole child and whole family approach. We'll often get the families involved. They don't always participate, but we certainly ask them to participate on the conference calls. We've done cross-training with not just, DCF coming to DJJ, but DJJ going to DCF. We've done the cross-training in group homes, our respite providers. We've done it for CPIs with DCF. We've done it with the family care managers, which is where it's the case management's contracted out to. We've trained with law enforcement, the court system. So it's not just, we do not just cross training, but we understand each other's systems as best that we can anyway. I mean, our system is JJIS, it's a juvenile justice information system, and then DCF, the delinquency system, is FSFN. What does that stand for, Joelle?
Florida Safe Families.
All right, I'm glad I didn't stump you on that one. So being and knowing those systems is very important, and it certainly helps us, you know, and we can just call each other to help navigate through them because we do training on them. So this is basically our process here. We have, you know, the identification, notification is kind of the phase one. So the way it comes in is that, you know, if a youth is arrested, they come into my screening unit here in Circuit 5, and once they're scored out, the screening unit probation officer looks in FSFN to see if they're involved with DCF. And whether they're involved with DCF under investigation or in services, either way, that's what starts the whole process. So we start an email, we update the email group from time to time whenever staff come and go. So, and then we have what we call a CYPM script, and then we put in the subject, obviously confidential, crossover youth, and then we put the initials of the youth so that the back and forth reply alls can be tracked by the initials, and that's kind of basically how Joelle sets for the staffings, by paying attention to the initials and what youth that it is. So once we do that, you know, we have the initial community, we assign it to the probation officer the very next day, if not that day sometimes, and we kind of consider that day zero. And then we have the probation officer call the CPI to get the information in that script, which we'll go through that here in just a second. And then they'll set an intake with the family within the next 3 days. And if those youth are in services, then we'll do a joint intake. But if they're under investigation, then DCF has already been with the family and gotten that information, so we'll just speak with them and get it. And then we go back and forth a little bit, and then they come back and we attach our face sheet as well as our assessment tool and how they score with it. And then Joelle sets it for local review team staffing, where we have several different agencies as part of that staffing. So as we know, this population of youth moves in and out of the county and the circuit. So and what this is talking about as far as our civil citation, because it's probably not called this everywhere else, but it's basically it's just that, it's a citation, so there's no record for it. But we have a prevention web that we keep it in. So we have a probation officer that reviews that prevention web daily. That way, if one comes up, then we're looking at it, and we're making sure, since many of these youth, especially ones that are in the system, if they're going from county to county to group homes, we're reaching out to other circuits, or if it's within this circuit, other counties, to help them get those sanctions done, because if it's not, it gets sent back to the court, which will then likely the youth will end up on probation. So we want to make sure that we're keeping from that. So since obviously communication is key, and like I said a while ago, we discussed our CYPM script. Some of the information that we have in there, I'd already talked about the notification of crossover youth, obviously the name, date of birth, our DJJ ID number, the date of arrest, the charges, the status of the youth, whether they're just intake or maybe they're already on probation or on home detention or possibly even committed, depending on the situation. When the court date is, who the probation officer is, what the placement is, the school, if there's any diagnoses, who the CPI, which is a child protector investigator, is, what the FSFN number is, information on the investigation, needs of the youth, high-risk behaviors, recreational social needs, family relationships, DCF referrals, family strength. So we're getting all that information in this script before we send it back and staff it, so that everybody can look at it and know where we are with it.
And what Randy is mentioning, we have attached as supporting documentation to the webinar, so feel free to look those over. And it's detailed out in our CYPM protocol that is attached. So looking at our process framework, we are very fortunate in Florida. There is a Florida Children's Cabinet, which is championed out of the governor's office, and it has lots of high-level state officials involved in it. They recognized the need for interagency communication back in about 2011 or so. They came up with an interagency memorandum of understanding that they had all the agencies sign back in 2012, and it fit perfectly with the model that we were moving towards with crossover youth practice model, because what it does is it essentially dictates to the agencies, the state agencies that serve children, that if you are serving a child that is involved with multiple agencies, then we should be communicating about that child all together. And so what it does is it kind of sets up a framework that we would have a staffing or a meeting about a child on the most basic level. Well, that's, and for us, that's at a county level. And then if we had disagreements or about cost sharing or services or any other type of disagreements, we could bump it up to the circuit level to be discussed at that level, and then we could escalate it to a region level or a state level. So it created a dispute resolution and escalation process for our state agencies. And so some of the state agencies include those that serve children with disabilities, our Medicaid, managed care, Department of Juvenile Justice, Department of Children and Families, so all of the state agencies that serve children, including Department of Education. And this process could be used for community children, non-foster care involved as well. And we use this a lot in our CYPM process for prevention and diverting children from coming into the foster care system. We, in our Circuit 5, created county-level teams. We have 5 counties in our judicial circuit, and so each county is unique. We've created county teams in order to staff children at that basic level.
And I'm not going to talk about the data too much, but we had a control group and an experimental group. The control group had 28 in it, and the experimental group had 25 in it. So of the dependency and delinquency data, we've sent that to Georgetown University, and it's came back and forth a little bit, and I believe we're done with it now. So I'm certainly looking forward to seeing the research on that. So the thing to take away from this slide is that, as you can see there on the right, that there's many more dually involved females that are getting arrested, and that the average, so there's more dually involved youth getting arrested than just DJJ involved youth getting arrested. It's much higher with the dually involved youth. And the next slide, you can see there that assault and battery is a #1 charge, not just for DJJ, but dually involved youth. And if you look over there to the right on those 2 big graphs, you'll see that dually involved youth are getting VOPs at a much higher rate, and you'll see that 15 and 16 years old is the highest population of kids. And the last slide there, if you focus on probation diversion, you'll see that dually involved youth are not getting a diversion as much as a DJJ, just DJJ involved youth. You'll see that probation, in the probation area there, that dually involved youth are getting sentenced to probation more often than just the DJJ involved youth, and that dually involved youth are getting committed to programs at a higher rate than DJJ involved youth. And yes, I know these slides are a little old, but I know that our headquarters data people are working on getting these updated, and we'll have that information before too long.
Okay, so just wanted to share some additional data with you on our county level staffing teams, just really quick. And this, to me, is so important because it's prevention work. These are kids that are arrested DJJ looks in the system, identifies them as having an open abuse investigation, and we come together and staff these children. So while they have an open investigation, they are not in the foster care system, and we hope to keep them that way. So there's some data here. When we first started our model, from January 2017 to August, you see that data there. So when we refer to lockout children, that's the children where the parents say they don't want to pick them up. We had 9 during that time frame. This year, we've modified our data tracking and staffing tracking tool that we've been using to capture better data. So we're learning as we go along. That's been a big part of this model. Again, is tweak and modify as you see needed. And we wanted to better capture the type of youth that we're staffing on the community prevention end. So I just wanted to point out, for this year thus far, we've had 72 staffing. You see the breakdown in gender there. The average age is about 15. We've had 33 lockout youth, and we've been able to divert 30 of them, which I think is huge. Again, we have about 70% have Medicaid insurance, and the reason why that is so important is because our Medicaid plans in Florida are required to have behavioral health navigation services. So getting those plans involved with the staffing team was hugely important because usually insurance is the payer source of services. And so getting them involved up front, knowing what services can be paid for and can be authorized is huge. You also see the breakdown of the youth. The biggest type of youth that we're seeing are ones with the family or behavioral issues. We are also on the rise on seeing issues with children with sexual behaviors, and there's a real crisis in placements and trying to put those kids in a placement when they're on the community end. We don't really have respites developed for those children. In the slides, we've included some examples. I'm not going to go through them right now because we're running out of time, but when you look at those examples, I want you to think about what more information would you want to know. There's a lot going on in these examples, and it's pretty typical of our families. This is not cases that we just made up. These were actual cases. And so, who would you want at the table to discuss this child? What service options would we want to be thinking about? Not just delinquency. We'd want to be thinking about, voc rehab or any type of educational, vocational services as well. So there's 3 different examples you can take a look at when you have some time. Just wanted to say that all of this has helped us with the communication challenges among the agencies. These cases are very challenging. The concept of teaming and team decision making, I can't stress how valued that is in this process. And we still face the same challenges as placements and lack of mental behavioral health supports. But because we're able to come together and utilize the strengths of the team, we are able to work and help these families. Again, like a key highlight is we've been able to divert 90% of our community lockouts from coming into foster care. I consider that a huge success. Lastly, I just wanted to share with you, creating navigational tools and high-level service navigational tools is really important. For staff, we've done that for our DJJ and DCF staff and helping them know where to go and some of the critical issues to look at. For instance, if you have an adopted child or a child that's disabled, you may have agencies that serve those children. And so giving your workers the resources and knowing where to navigate is huge. So we spend a lot of time doing that and trying to create materials for our folks to learn where to look and who to ask. And that is also in our CYPM protocol, so if you want to take a look at the bigger document, you can see it in there. Thank you again so much for the opportunity to present. We appreciate it.
Great. Thank you so much, Joelle and Randy, for that great information. So we're going to open it up now to a Q&A section for all of our presenters. So we have received a few questions through the Q&A pod, so thank you to those who had submitted. We're going to go ahead and dive right in. The first question that we've received for Macon is when you reviewed the demographics for the crossover youth, we have a participant who wants to know if that's from national data.
So the initial set of slides that I reviewed were national data. The data that I showed at the latter half of my presentation was from data that we've collected on communities that have implemented the model. So the first set of slides, yes, national. The latter half of those slides were from our CYPM sites and that data.
Great. So we have another participant question for the San Diego site. So the question is in regards to how does San Diego share CWS CMS data entry responsibilities?
So we have, whoever is the lead agency has primary in CWS CMS, and the non-lead agency has secondary. So both have, whoever's the lead agency is the one in charge of making sure that the placement's in there and everything else. That, which is primarily HHSA. For CWS, we primarily have primary on most of those youth, but that's how we document. And everybody documents contacts in CWS.
Also, there are additional officers within the probation department as a youth is coming into the facility or has a referral made to probation that have access to determine whether or not the youth is involved with Child Protective Services.
Okay, great. Another question, this one for the Florida site presenters. And the question is, how do you find success working with crossover youth who do not have family or a support system?
Well, one thing that we do is we try to reach out to as many mentors as we possibly can and bond them with other positive role models. One other thing that we have with DJJ anyway is we have a contract with a provider called Project Connect, who does a really good job of mentoring the youth as well as helping them find a life coach within the family or the community. So we do our best to book as many of this population of kids with Project Connect as well as trying to partner with other services that have mentoring programs.
Okay, thank you. Another question, this one for San Diego. One second. Do any of the youth achieve permanency prior to the age of 18? And if so, how? How many?
So we don't have an actual number with us right now. However, there have been several. We actually have a family maintenance case where the youth is placed with the parents, and we have placed several youth with relatives.
One of our permanent plans is fit and willing relative. We have other youth who have been in kind of guardianship active to dual status. We have been able to maintain and preserve a guardianship, and we do continue to search for permanency options for those youth. We continue to try to explore those options.
Okay, great. One question for the Florida site as well. We're getting a lot of questions for the implementation site, so if you have any for Macon, please submit them as well. What could a mental health agency do in this process to help? What I am seeing is it's vital for child welfare and law enforcement probation to increase and have excellent communication and collaboration.
That is very true. And what a mental health agency could do is reach out to those agencies, reach out to the delinquency and to the child welfare, get them acclimated with the services that are provided there, because those agencies, we are always looking for mental health and behavioral health services and finding out who can do evaluations and assessments to refer to. For us, we have a lot of challenges finding Medicaid providers, and so the more we have, the better off we are that we can, it opens up referrals so we don't have wait lists. So I would just say the mental health agency should reach out to them, maybe do some training, and possibly get involved with some of the prevention staffing teams if they have services that could be available to those youth.
Okay, thank you, Joelle. We do have a San Diego site who wants to chime in as well.
This is Stephen Wells, manager in Child Welfare Services. In the same way that we have our collaboration with CYPM between all of our partners that you've heard today, it also connects to other parts of our system, including our joint collaboration with the with behavioral health system that we call Pathways to Wellbeing. So we have a structure that that really provides pretty intensive mental health screening and family-centered meetings that we call child and family teams, where we get the entire team of stakeholders together, professionals and also natural supports, to make decisions about mental health services, mental health supports, finding a uniquely tailored placement for the youth. And so our behavioral health system is actively involved in all of the service coordination conversations that happen with our youth, and we, through that collaboration, have been able to leverage a really strong relationship with our behavioral health system as additional partners to the process.
Great. So unfortunately, we are out of time, and we do have a lot of questions that we didn't get to, so I apologize. So if you have, if you want to get in touch with our presenters, you can see the CEVC's contact information up on there. Please reach out to us. And you could also see that we have other ways to get in touch with us. So if this is a topic that you're interested in learning more about, please reach out, and we can hopefully connect you to some of our presenters who can answer your questions as well. So with that, I'm going to end, but I want to thank all of our presenters for taking lots of time out of their busy schedule to present on this topic. We greatly appreciate it. And if you would like to provide us with feedback to our webinar, you'll be receiving an email with a link to a survey on this webinar. So with that, thank you for participating, and have a good day.